Yes, you read it right. HMPV virus is really nothing to be afraid of. It has been around for centuries, just like common flu and fever and influenza and all that stuff. But wait, what about the panic in all the news and the social media? Are we gonna have another 2020-like scenario with millions infected, hospitals overflooded, and people dying helplessly? Well, the short answer is a big no. Here's 5 things to know about this virus. Human metapneumovirus or HMPV is one of the viruses that causes upper respiratory infection. It usually makes people only mildly sick, but it can make people very sick. The virus belongs to the Pneumoviridae family of viruses, along with respiratory syncytial virus. It was first identified in 2001 and has been spreading among people for many decades. It has an incubation period of typically 4 to 6 days after exposure. Major symptoms include cough, nasal congestion, fever, and difficulty in breathing in some severe cases. The virus spreads via respiratory droplets, direct contact with contaminated surfaces, or close contact with infected individuals. HMPV is actually pretty much like a seasonal flu, most prevalent during late winter and early spring. While any person can catch the HMPV, this particular virus mainly affects infants and children under 5 years old. Other than children, elderly individuals or those with weakened immune systems due to conditions like cancer, HIV, or organ transplants are at greater risk of severe outcomes. In most cases, the patients recover on their own. Only a small percentage may require hospitalization, especially those with pre-existing conditions like asthma, COPD, or any other respiratory issues. Although HMPV was officially discovered in 2001, retrospective studies indicate its presence in human populations for at least 50 years. The virus is thought to have evolved from a common avian metapneumovirus, crossing species barriers to infect humans. Recent reports from China indicate a surge in HMPV cases, particularly in urban centers like Beijing, Shanghai, and Guangzhou. Experts attribute the rise to factors such as increased travel, crowded indoor settings, and seasonal vulnerabilities. Unlike COVID-19, there is no specific antiviral treatment for HMPV. However, basic supportive care is more than enough in managing symptoms. These supportive treatments include ensuring adequate fluid intake to prevent dehydration. Over-the-counter medications like acetaminophen or ibuprofen can reduce fever and discomfort. In severe cases, which are really rare, oxygen therapy or mechanical ventilation may be necessary. Still, if you are scared, just follow the same basic protocols from 5 years ago. Wash your hands, avoid close contact, wear masks, use sanitizers, you know the drill. A polymerase chain reaction or PCR test can detect HMPV in say 3 hours, but in most cases nobody bothers. Is there a vaccine? No, because again, who makes vaccines for seasonal flu? The mortality rate is nowhere near COVID-19 and only a significantly immune compromised person may be at a slight risk. The virus also is much less contagious and a community spread is highly unlikely. And most importantly, you probably have partial to significant immunity against HMPV. It has certainly been around for more than 6 decades without really causing any major pandemic. So, don't panic, this is not COVID 3.0, just an irritating little seasonal sneeze and some running nose.